Okay, let's dive into this. Welcome to today's explainer. You know, if you or someone you love is navigating the world of fertility care right now, you probably already know that it can sometimes feel, well, a bit like walking through a maze in the dark. It's deeply personal, can definitely be overwhelming, and it's often just filled with unanswered questions. But today, we're going to turn on the lights. We're walking through this together. Consider this your warm, supportive guide to understanding some of the less common, but absolutely crucial fertility conditions. We're going to look at how your body works, the specialized tests that are out there to help you, and the treatments that offer real, tangible hope. Our main goal here? To replace that fear with knowledge and swap out the confusion for absolute clarity. Let's get started. I want to kick things off with this incredibly powerful piece of reassurance straight from the medical experts at ART Fertility Clinics. It says once the exact cause of infertility in a female and male is diagnosed, the chances of a successful pregnancy increases dramatically. I really want us to hold on to that word for a second, dramatically, because, so often we view getting a medical diagnosis as a bad thing, right? Something to be feared. But in the world of fertility care, a diagnosis is actually your greatest tool. It's literally the compass that points you exactly where you need to go. It shifts you from just guessing to actually knowing. And that totally transforms a diagnosis into a solid foundation for true empowerment. Section 1. Uncovering hidden health factors. Now, what's really interesting here is how we can group these underlying conditions. To get to that accurate diagnosis, we first have to look at the whole picture. Because sometimes the body has these hidden factors just quietly impacting fertility behind the scenes. We've got lifestyle and metabolic factors like diabetes, which changes how your body handles insulin, or obesity, where excess weight can actually deeply impact your reproductive function, and even something as incredibly common as a vitamin D deficiency, literally just lacking the sunshine vitamin, can play a hidden role in pregnancy success. Crazy, right? Then we step over into the complex systemic factors. Things like autoimmune diseases, past cancer treatments, hormonal imbalances, and thyroid disorders. Did you know an estimated 200 million people worldwide have some kind of thyroid issue? Any single one of these things can be that missing puzzle piece explaining why you're having trouble conceiving. But the beauty is, once we map these out, they can be managed, treated, and seamlessly factored right into your very own unique fertility care plan. Moving on to Section 2, finding answers through testing. So how do we actually uncover those hidden factors? Well, through specialized testing. Now, I know the word testing can instantly induce anxiety for a lot of us, but honestly, it is simply your medical team listening closely to what your body is trying to say. For instance, let's talk about a term that causes so much frustration: unexplained infertility. Medically speaking, this is defined as difficulty conceiving despite regular unprotected intercourse for at least 1 year. If you've been handed this label, let me just say, your frustration is incredibly valid. Hearing "we just don't know" is utterly exhausting. But here's how you should view this. Unexplained infertility is absolutely not the end of your road. It's actually just a signpost telling you that you need to take a different path. It's the starting point for deeper, more specialized assessments. It really just means the basic tests didn't catch the issue, and it's time to dig a little deeper with better tools. And this brilliantly illustrates one of those exact specialized tools, the SHG, or sonohysterogram. Now, I know medical terms can sound super intimidating, but let's break it down. An SHG is simply a special, completely non-invasive ultrasound test. No incisions are made on the skin whatsoever. It's just a gentle procedure that gives your doctor a much clearer, high-definition picture of what's happening inside the uterus. It's wonderfully reassuring, proving that modern medicine can look closely and safely to find the answers you need without putting your body through any overwhelming stress. Let's move to and see how this builds a really clear path forward. When you look at the fertility process broken down into just 3 simple steps, it removes so much of the overwhelm, doesn't it? Step 1, diagnosis and assessment, finding that root cause we've been talking about. Step 2, creating a personalized treatment plan based strictly on that specific assessment. And finally, step 3, improving your chances of a healthy pregnancy. You don't have to figure out step 3 while you're still on step 1. You literally just take it one clear, logical step at a time, guided completely by your medical team. Which brings us to Section 3, your personalized treatment path. Once you've gathered all your information, you arrive at the solution phase. This is where knowing your exact specific cause transforms the entire process. According to the clinical experts we're referencing today, specifically Professor Dr. Human Fatemi, there is one critical philosophy that rules modern fertility care, and that is the personalization of treatment. So what does this actually mean for you? Well, it means your fertility care must be as absolutely unique as your fingerprint. You are not a statistic. You are an individual with a highly specific medical reality. Whether your hurdle is a thyroid disorder, a simple vitamin deficiency, or something structural, your treatment should be uniquely tailored to address that exact reality and nothing else. Think about the stark difference between a standard, untargeted approach, which is kind of like throwing a dart with a blindfold on, versus targeted solutions based on an exact diagnosis. Personalized treatment is a real game changer. It might mean something as straightforward as specific drugs to balance a hormone. It might mean minor surgery to rectify a physical problem, or it could mean advanced procedures like IVF, which is in vitro fertilization, or ICSI, where a single healthy sperm is carefully injected directly into an egg. These are simply precise, specialized tools that provide excellent, life-changing results, but only when they're perfectly matched to the patient's unique diagnosis. And finally, Section 4, taking the next step. We've covered a whole lot of ground today, from uncovering those hidden metabolic and systemic factors, to the gentleness of non-invasive testing, right through to the sheer power of a personalized treatment plan. Now we arrive at the most important part, where you go from here. Are you ready to find your answers? It's a really big question, I know, but I want to offer you a comforting thought. You do not have to walk this path alone. You don't have to be your own doctor. There are dedicated, specialized clinics out there fully equipped with the exact technology and the compassionate expertise needed to help you start your assessment. Reaching out to book that first appointment, that is the bravest, most productive step you can take.
So the crucial point is this. Once the issue is known, the solutions are wonderfully abundant. As we see here, fertility treatments range from the simple administration of drugs all the way to surgery for rectifying the problem. The toolbox is incredibly deep. Modern medicine has practically created a specialized key for almost every single lock. You just need the right team to help you find which key fits yours.
Every single fertility journey is uniquely its own. Yours might take a little more time, maybe a little more testing, or a little more support than you initially thought. But the answers are out there, just waiting to be found. I want to leave you with this one provocative, hopeful thought today. What will discovering your missing puzzle piece mean for your family's future? Hold on to that vision, take a deep breath, and take your next step forward. Thanks so much for joining me on this explainer today, and we'll see you next time.